Welcome to this week's VSee Telehealth Secrets webinar. Just a few housekeeping items before we get started. First of all, we love getting your questions, so please submit questions from the chat or questions box anytime during this presentation. We'll do our best to get to them. There are slides that are available for download. You just need to tap on the materials icon, and the top should be the top right corner. And this session is recorded and will be sent out afterwards. Finally, please keep an eye out for our next telenursing webinar. It will be Wednesday, February 21st, for some more perspectives on the viability of telenursing. And with that, I'll go ahead and turn the time over to Milton, our moderator. Go ahead and take it away, Milton.
Thanks, Anne. Hello, welcome to another Telehealth Secrets webinar. I'm Milton Chen, CEO of VSee, and we've been spending a bunch of time last year exploring telenursing, and we came up with a mechanism to this what we call digital triplet. And today, I'm just so excited to have two amazing people joining us on our webinar. We have special guest CJ Robinson, who's a senior manager from Oracle Health Innovation Group, and Kelly Swank from Children's National Hospital in DC metro area. And again, CJ is a recognized nurse leader who has previously directed the Magnet program at Santara Lee Hospital. And Kelly has been a cardiac ICU specialist for over 10 years and is currently coordinator of Children's National Telecardiac ICU Command Center. Again, so you can find out all of their amazing accomplishment in their formal bio. But again, so we just want to maybe share something like a fun fact maybe you don't normally see in a bio. For example, something CJ, you probably don't know her, in that she is, so she has 3 young children, and they spend, I think, couple of months and going through Europe on a single suitcase and 4 backpacks. And they work through 9 countries using only the public transportation. And I'm pretty sure she had amazing experience, amazing time. And the fun fact about Kelly is she's a 2nd degree black belt in Taekwondo, and she used to perform and compete in competitions. I'm pretty sure she take her kicking butt attitude pioneering in telenursing. I can't wait to find out what she had to share. And she's also a foodie. And if you ever need a restaurant recommendation in DC area, she's your person. Again, we're welcome CJ, Kelly. Thank you so much for joining us at the Telehealth Secrets webinar. Again, maybe I'll just first turn the floor to you guys and share your thoughts. Again, audience, please keep your question coming. Again, as soon as it finishes, we're going to open the floor and just have your shot and pick their brains and have a dialogue. Okay.
Awesome. Well, thank you so much, Milton and team, for inviting us today. I've been looking forward to this discussion, and I have to say, I can personally attest to Kelly's gifts as a foodie, having eaten with her in DC a few times. She is absolutely on point every single time. And I will spare you guys some of the more gnarly stories about traveling with 3 tiny children in Europe. Let's just say we spent some time throwing tantrums on the floor of some airports at various and sundry times. But Kelly, if you'll move to the next one, I just want to echo Milton's comments. Like, one of the reasons we're so excited about this webinar is that it gets to be a dialogue. My team at Oracle Health on the innovation team, we've had the pleasure of working with Milton at VSee for a while now. And I just really appreciate, like, Milton, your thoughtfulness in putting these sorts of things together to ensure it's not just a bunch of rhetoric, but we actually get to engage in some real and lively discussion. So can't promise that Kelly and I will have all the answers. And in fact, I can promise that we will not, but always enjoy the discussion. So this is kind of where we'll go today. Just kind of give a big picture overview of, I'll tell you a little tiny bit about Oracle and Oracle Health in case you're interested. Kelly will tell you some stuff about what they're doing at Children's National. And then we'll kind of ground ourselves in some of the big challenges that we've seen telenursing starting to address. And then, one of the things I love about working with Kelly is just her lived experience in actually implementing telenursing at a site and driving some real change and driving some real good. So we'll have a back and forth about some of her lessons learned there. And then we'll spend a little bit of time talking about, how do you assess whether or not you've had the impact that you want, and then communicating that impact to other stakeholders inside and outside of your org. So, and then we're hoping for a lively discussion. So with that, we'll just dive right in, because an agenda slide is always the most boring slide in my humble opinion. So Kelly, over to you, my amazing friend.
Yes. So, hello, everybody. I'm going to give you a little bit of background about Children's National Hospital. We are a 323-bed acute care hospital located in Washington, D.C. We're a level 1 pediatric trauma center, and we service the DMV area, so D.C., Maryland, Virginia area. My specialty is in peds cardiac and telehealth. And so the cardiac intensive care unit is a 26-bed CICU unit. We do over 300 bypass cases per year. And we also do ECMO as well as heart transplant. We actually just had one today, and it is beautiful. Yes. The telecardiac ICU opened in 2019, and nursing was introduced to that program a year later in 2020. And I'm going to go a little bit in more detail about the tele-ICU nursing program in a few more slides. I'll hand it over to you, CJ.
Thank you, my friend. All right, I think it's transitioning. Here's the Oracle Health slide. So this is just kind of a, in case you haven't heard about Oracle Health, Oracle acquired Cerner a couple of years ago. Now we're Oracle Health, and this is just a description of what we're trying to accomplish in the industry. A human-centric healthcare experience powered by unified global data. So later on in the presentation, we'll talk a little bit about, the role that data has to play in telenursing, and particularly the role that data has to play in as far as where it impacts that clinician workflow and experience. And then I myself am on the Oracle Health Innovation team, and it is just really a phenomenal place to work and be. I mean, I know it always sounds a little bit self-serving to say that out loud, but it's a fantastic team. I love it. It's how Kelly and I got to meet just doing a visit at Children's National. I saw her doing that fantastic work in the telemedicine, in the telehealth command center that she's in. But the innovation team is really focused on, identifying what can we do when we bring the right people together to solve the right problems in healthcare. So whether that's partners, whether that's tech, whatever it may be, like what do we really need to facilitate in order to accomplish all of those big dreams that we have in improving healthcare? Because I think, the challenges of delivering healthcare are well articulated and well documented. And then when I'll also confess, when Milton shared the opportunity to have this webinar, one of the things I feel very strongly about, going back to my days as a magnet program director, is involving the voice of the folks doing the work in the actual design and implementation of the work. So that's why I just had to bring Kelly along, because she is the one at the edge, right, doing the actual work. So I'm really excited for this opportunity to have a conversation with this complement of stakeholders in telemedicine and telenursing. So I think, Kelly, if you go to the next slide, we'll start at just a really high level. So like I mentioned, Kelly and I, oh, sorry, Kelly, this is your slide. My bad. Yeah, no worries. Go for it. Oh, here we go. Sorry, guys. So, like I mentioned, I met Kelly, I think about a year and a half ago when I was visiting her hospital, and we've had a lot of really fantastic conversations, both together and with other stakeholders in the field, about what are we understand the challenges associated with delivering healthcare, but what are those challenges that are very specific to the ones that nursing can address, and particularly in this type of setting? So one of the things that we've identified is limited access to care. This isn't necessarily related strictly to the Children's National Command Center, but I think someone I had a call with the other day mentioned that there's only one genetic counselor for something there are like whole states without genetic counselors in the US and let alone globally, right? Where you're able to get the right information associated with, even just knowing what you should do and how to, the symptoms to watch for when your child has a genetic condition. So everything from like omics to even just like, my kid has an ear infection. Can I just get like, get some information about like taking care of that sort of thing. But really reimagining the way that people experience healthcare and accelerating their ability to get the right care at the right time from the right person who's providing that care. The other piece here, limited healthcare resources, which is basically a nice way of saying that we have a staffing crisis, right? So everyone has seen all of the articles associated with burned out nurses and nurses leaving and challenges associated with retaining nurses. And then of course the impact that has on hospital finances and the trickle down effect that has on your ability to acquire other resources. So really looking at telenursing to figure out, like, can we leverage some of this technology and leverage some of this some of the tooling to address some of those fundamental challenges when it comes to resourcing. And then, you think about the patient experience, and I'll let Kelly, speak to this a little bit, but particularly her role in acute care and like as overseer and like a help and an assistant to the folks on the floor delivering the care can really help streamline the patient's experience. Kelly, do you want to say just a couple words on that? I don't want to steal any of your thunder from the next slide.
Yeah, absolutely. And we really focus on, taking a look at the patient from like a grand perspective. We're overseeing the kids as a second set of eyes, and we're diving deep into the patient's charts. I mean, I think we can all agree we have an abundance of data at this point, so much so that one person looking at it might miss something, might overlook something, or view it slightly differently. And so by having a bedside team that has primary care of the patient, as well as a telehealth nursing team, physician team, also overviewing the patient, we're providing that second layer of support. We're able to identify any sort of issues, adverse events that might be coming on throughout the day and not just one point in time during, maybe rounds with the physician, and then reassessing these kids from that perspective. And so by doing that, we can improve clinical outcomes for these patients by quickly identifying any sort of issues.
Yeah. And then finally, in efficient operations. And this is where, like, today we'll be very tightly focused on acute care telenursing, because that's where, honestly, both Kelly and I have primarily our expertise when we think about telenursing and where it can like fit in this entire healthcare operational perspective. There's a lot of opportunities, both in terms of, hey, this nurse has too much to do for one patient. Let's figure out a care delivery model that can help address those challenges to even larger when it comes to hospital operations, or even impacting pre and post hospitalization or prevention. So there's a lot we could dive into there. We're not going to spend any more time. I know y'all are probably dying to hear about Kelly's work and this amazing command center that you see behind her in her fancy screen.
Yes. So yes, behind me is the telehealth command center. As you can see, maybe I can turn a little bit. We have lots of technology, lots of monitors, and a really awesome dedicated team of physicians and nurses in here that are overseeing the patient. So a quick overview of our tele-ICU nursing program. We provide a second set of eyes for the patient. We also provide a lot of support, proactive support for the bedside nurses. We are taking a look at these kids and also saying, well, what does a nurse need for her day? How do we set her up for success as she moves throughout her day? And our biggest mission in here is to prevent cardiac arrest. And that's a huge ask. That's a huge task. And we are on the way to hoping to identify what that is, and prevent cardiac arrest from happening before they do, by using a lot of the technology that we have today, which is real-time video feed. We have access to all 26 patients' rooms. We can see everything that's happening in there. We also have an AI decision support tool that gives us an indicator for inadequate oxygen delivery, and that is an amazing tool for us to use. We highly rely on that. Of course, we use our EHR and any sort of imaging tools that we have to kind of compile all of this information together. After reviewing the patient, we collaborate with the bedside team of physicians and nurses, and we share any new information with them, any changing information. I think, we can safely say that patients change throughout the day, throughout their course. Maybe in the morning, the patient's not so sick, but by the afternoon, something has changed. And we are looking at a very, very sick patient now. And so the bedside nurse is usually the first one to notice, but we are there to support her by providing her all that data, showing that, yeah, you're right, you're on that track of like something is wrong, and let's show this to the physicians, and we're gonna take some action here. On the right side of your screen is showing the 3 different types of support that we provide. We have clinical information support, and that's raw data. It's raw data that you find in vital signs, and medications, and lab values. There's so many of these numbers, and we are able to kind of pinpoint ones that are more important that need to be addressed sooner rather than later. Clinical decision support is where we do a lot of our support for bedside nurses. It's clinical nursing advice. It's, we learn from each other as bedside nurses. So we are used to asking each other for advice. And, with the staffing shortage that we have now, we don't have that time. We don't have that resource that we used to have. And so by providing this type of telenursing, they're able to call us, say, am I on the right track? Am I doing this right? Can you just double check what I have going on? We do also a lot of teaching, pre-op and post-op teaching for our cardiac surgical patients. We also do a lot of teaching on prognosis, what to expect, and how to prepare for that. And so what makes it slightly different than a traditional tele-ICU, I think majority of the tele-ICUs or tele-nursing programs are in a remote location. They're located in a completely separate building away from the patients, may or may not even be in the hospital. We, on the other hand, are located in the very center of the cardiac intensive care unit. That beige-ish door, I can open that door and that's a patient's room in front of the door. So clinical bedside support is something that is a little bit faux pas, I think, in the tele-ICU world, because we want to keep each other separate. But we are finding here in this pediatric space that we need that hands-on support. The nurses need that hands-on support. We opened in 2020, which is like perfect time when COVID hit, and when we had a huge mass exodus of experienced nurses, and we're asking bedside nurses to do much more than we have ever asked for. And so by having the tele-ICU nurses here to support, not only with education, not just with data, not just with talking over the phone, we can walk right to their room, start compressions, give that dose of epi. We can show them how to do a dressing line change. We can do all the hands-on work that you used to have back in the day, 5 years ago. And so we're able to provide that type of care to the patients and to the nurses. CJ, I'll
Thank you
bring
so
it back
much,
to
my
you.
friend. Yeah, yeah. And I know I keep bragging on you, but it is just so phenomenal what y'all have been able to do there at Children's National. And so I wanted to kind of take a moment to pick your brain a little bit on, when you were implementing, because I think you've been there from the beginning, right, Kelly, or at least almost the beginning.
Yes.
So
Yes.
and you might have already said this and maybe I missed it. How many years have y'all been around?
So in 2019 is when they opened the tele-ICU, but it's physician to physician. We didn't implement a tele-nursing until 2020, and that's when I started it.
Got it. Okay, perfect.
Yeah.
Thank you. And so as we've talked about the evolution of the telenursing support at Children's National, I think these are the big buckets that we've identified, things that, had, lessons learned, or folks that you needed to really think about, the things that you needed to really think about when implementing. So, I know we've talked about like characteristics of the workforce and how you can really like structure this to capture and really harness some of that expertise and power of the workforce that can to keep it from like leaving the organization as folks look for other opportunities, and just various characteristics of the workforce that you've identified that are really important for implementation. Do you want to talk about that for just a couple
Yeah.
minutes?
Oh, I mean, we had so many experienced nurses step away for various reasons. Of course, during the height of the COVID pandemic, there was that reason, but there's also just a normal exodus of staff who are transitioning, whether to go a different route in healthcare or retiring. And so, we're at this point right now where there's a baby boomer generation of nurses that have been nurses for a very, very long time, and they love the profession, but they may not be able to physically work 12 hours and do night shifts, or really want to take on that patient load, that stress. But they have so much knowledge in their brain, and they're such great teachers because they've been teaching for so many years. And so this virtual nursing space is a really great place for them to kind of shift over to a different area, but also caring for those same patients, and being able to share all their knowledge with the newer, younger staff that are very thirsty for all of their expertise.
Mm. Yeah, I really appreciate that. You can basically solve two problems at once with this sort of solution. And I know that we want to leave like a large chunk of time for questions, so I'm kind of just going to buzz through some of these other pieces here. I have a slide for the workflow. Don't go there yet, Kelly. It's the next slide.
Okay.
But like, also
Okay.
just want to acknowledge like some workflow considerations, which I'll talk to in just a second, and can definitely dive more into that if folks are interested. Two, obviously, is the technology. Like, Kelly, I don't remember how many screens that you still use today. I think it's 6. Like,
Yeah.
really, like, this is a challenge that I don't think that we have completely solved yet, but that Kelly and I are definitely scheming on, and Milton and VSee too, right? Like the what are the tools that we need to enable this? And then of course, like the change management, like this represents a significant shift in even just the mindset associated with care delivery systems, right? And so being very like intentional and respectful of this profession that's been around for so long, with a huge diversity of expertise and experience, and who have watched this like lots of folks with amazing expertise who have watched this evolution in healthcare and the technology associated with its delivery. I know, Kelly, like that's something that we can definitely dive down deep into more as well, just some of those like lessons learned along the way. But one thing that I want to really pull out, and again, like this is me, Kelly, if you'll go to the next slide, like CJ as a nurse, something I care really a lot about is understanding how people are working. So this is a slide from a study we did at an institution, just looking at the various process that one nurse does, using just like in the EMR, one nurse, one EMR, one shift, and the number of different clicks and places that they have to go just to do the digital component of their work. And so what you can see from this slide is like, it's intense. It's a lot. And like, I know it's kind of small and you can't really see, but like we actually were able to assess like how much time were they spending on different places, what were the terminal ends, how many, like what were the processes associated with the work, what were the like really like the sequence of events, right? And so when we're thinking about like giant tools and structures like this, I think what we tend to do is like say, oh, telenursing is great, let's do that, instead of first sitting and understanding very deeply how this particular solution is going to fit into the existing workflow and enable it, enhance it, and not be a disruptor. one of the things that used to drive me so crazy when I was a bedside nurse, and I'm so sorry if I'm, I don't mean to offend anyone, but just like the number of phone calls I would get from our telemedicine folks, like, the leads are off, the leads are off, your patient is about to fall. And I'm like, I know my patient's about to fall. The bed alarm is going off. I'm in the room already. Like, that phone call was just added to the stress and the disruption. And so as we think about implementing telenursing and creating the tools associated, understanding this spaghetti mix of like, here's the real work that people are doing. We need to understand very deeply, not at an 80,000-foot level, but deeply, how this thing is going to impact this work. And I will stay on that soapbox potentially forever, but in the interest of time, we can move on to the next thing. So another thing that Kelly and I have spent a long time talking about is like, how do you measure the success of a telenursing activity, and not just activity, but structure. And again, we can dive in more deeply into this if y'all want. Happy to have a dialogue about this, but these are the sort of things that we've looked at and Kelly has looked at as having an impact. But honestly, like, being able to demonstrate like a very crisp ROI associated with telehealth nursing implementation, like that has been challenging, partly because of the data associated and how intertwined all of the different hospital processes are associated with the delivery of care. So Kelly, I don't know if you want to say a couple words about that, and then we'll open it up to questions, or continue to just have a lively dialogue ourselves if folks don't want to
Yeah,
ask any questions.
I mean, I completely agree. Like, it's so hard for me to pinpoint exactly what that ROI is. I mean, it really stems from, and CJ and I've talked about this a lot, is like, can nursing charge? Like, in a hospital, like, we're lumped in with the hospital stay versus physicians are not, right? And so it's really difficult for us virtual nursing. Like, are we also lumped in with all of this? I think we are to some degree. And so, we really have to, we're looking at, clinical outcomes, or outcomes, and how we can make an impact over there and really prove our impact and our success. And what we have found here at Children's is, the clinical outcomes that we're looking at is a reduction in medication errors, a reduction in central line infection rates. A big thing that I think many institutions are starting to talk about now is a reduction in workload for nurses, how to give time back to nurses. And many institutions are doing admissions and discharges, and they might seem really easy, but that is not easy. That takes a whole lot of time and a whole lot of resources. And also, for patients and families, it is the first time you walk into a hospital bed seeing all these people that you don't know. And it's also the last time that you're going to have the support that you'd have before you go home. So it's a really critical point where we don't want to rush that process because the bedside nurses are busy. And so for a tele-nurse to be able to take that task on, we're really giving a lot of valuable time back to the bedside nurse, so that bedside nurse can go and take care of the physical task, and we can take care of the admissions and the discharges and the patient and family teaching, and comforting the family that you have a second set of eyes also watching over your kiddo. You have a bedside nurse and you have me too. And earlier, I was talking about preventing cardiac arrest, and so that is another outcome that we are looking at. How are we able to look at preventing cardiac arrest and decreasing hospital stay and addressing these adverse events before they happen? So there's a lot to talk about here, and I think I can go on and on and on as well. So I'll give it back to CJ and Milton and see if there's any questions to answer.
Kathy, CJ, that was phenomenal. And I really thank you so much for sharing. But I think for the audience member, please definitely pour the questions, come in, we'll have a dialogue. Maybe just to start things off in there. So Kelly, your presentation is definitely really intriguing. One question I have is it possible for the telenurse, the remote nurse, to handle all the documentations for the bedside nurse? I know like for our research, like people don't want to spend time documenting. Like, is that possible? Just completely, if you're bedside nurse, you're just hands free, like no more EMR.
Yeah, I mean, absolutely. It will take a little bit of coordination, right? As the bedside nurse is doing the assessment and everything, the telenurse could be right there with them in a two-way audio visual and chart that assessment so
Mm,
that the nurse can concentrate on the patient and not have to
okay.
remember everything that she just saw and did and then come back to the computer and turn her back to the patient and chart. And so absolutely, that is definitely a very
Okay.
effective way of using telenursing to support nurses.
Yeah, I feel like that could maybe one thing that will make all the bedside nurse a lot more happier. So, another,
Anything.
Can I add
um,
one thought to that, Milton, too, unless
of
there's
course.
another question, and then I can be
No,
quiet.
please go ahead. Yeah.
That idea of like I can deliver care without having to document anything specific, like the hands-free documentation I think you just
Yeah.
mentioned. I feel like in a lot of ways that is the holy grail of like what we're trying to drive towards, right?
Mhm.
I want as a nurse to be able to focus on my patient, but I also but that takes a couple of things. One is very crisp and clear like ability to coordinate between the person physically there and the person who
Mm,
is virtually there. And so these like the communication structures and like at any moment I need to know Kelly's got the admission and I am going to like document the IV or whatever it is like that so that we're not wasting time double checking who's documenting what. And then like ultimately this is a huge opportunity where integrated technology can really like take us so far beyond an EMR, right? Like computer vision and AI, like
mhm,
all of those things coming to bear, voice, like coming to bear so that, you are able to accurately and in a frictionless way, like identify, like capture the
mm,
work that you're doing and also like accuracy, right? Moving beyond,
yeah,
some of the transcription challenges. So I'll get off that soapbox
yeah.
because I know you have another question. But
That
No,
would be
that's
absolutely amazing. So if somebody can design that, that would be absolutely great.
yeah, that's awesome. I guess kind of have another question. I mean, you have a beautiful, amazing command center. I think this is where like most people like to drool over, like they wish they have the same thing, right? I know that for our research, a lot of the special hospital administrator, when they think about telenursing, is about able to reducing costs in there. So if you were to go back to the beginning, like having learn everything, redo your will you still build a command center or will you do like a fully distributed, even like let people like work from home to still from the telepart? Or do you find that really having a command center really key to, you know, your the operations?
Yeah, yes, this command center is absolutely gorgeous behind me. We're very lucky that we have a generous donation from the Board of Visitors ladies to be able to support this type of structure. We started off with just a very small room, and the
Mm,
technology is the same, right? I needed a computer, I needed an AI tool, I needed video feeds, and I think video feeds are going to be in every hospital very soon.
mm,
So you don't need this beautiful, massive room to be able to support virtual nursing.
mm,
But I do, to some degree, strongly believe that remote work sounds nice, and I think it is
mm,
possible to do this remotely. But I also find it really nice to have my coworkers sitting right there, and I can collaborate with her and I can ask her. It's very much nursing. I'm
mm,
as a bedside nurse, I just poke my head out the door and say, "Hey, can you come over and can you help me out? Can you just, double check what I'm doing?" I have that same feeling here working with my coworkers. Now, you can do this
mm.
over Zoom. We've done it. It is possible. So
Okay.
you can still have people from many different places working together collaboratively in a Zoom work environment. But here at Children's, because we are very lucky to have this space, this is not just a
Okay.
tele ICU. It is really a space for collaboration. We have surgeons come in here. We have interventional cardiologists. We have fetal cardiologists. We have imaging cardiologists. You have the bedside team. Most importantly, you have the bedside nurse. And they are all able to walk into this room at any point in time and discuss a patient. And we are able to share that same information. So we're not playing email tag or phone tag. We still have people coming on Zoom, so we're able to kind of hit it from multiple points, virtually and in person. And we're able to share all of this information in this space at the same time, so that when we walk out of those doors, everyone knows what is going to happen with this patient and what our plan is. So it makes it a very collaborative space. I don't know if that was the original intention of the space, but it definitely is a very nice outcome of having this space here.
Got it. Kind of really appreciate it. We have a question from the audience. Maybe this Kelly or CJ, maybe for diving. It's like, how did you staff the telenurse? Did you use is it from your existing pools that drafting there? Or did you actually go hire outside of your system?
Yeah, so for us, we find that it is very important to hire staff that have a high level experience in peds cardiac patients. So as of right now, we haven't hired internally, but that doesn't mean that, a very experienced nurse from another institution who wants to come here, that we're not going to hire them. It is, I think, for us, really based on your experience and your knowledge for these patients. And, my knowledge base is really peds cardiac, but when it comes to maybe adults or to an acute care space, there could be a bit of a wider range that experience levels for each candidate coming in.
For this, for someone to work effectively as a telenurse, assuming they have never done that before, like how much training do you feel like until they'll pass your threshold, like quality?
uh, surprisingly, once you have that patient care background, which an experienced nurse has that, it's learning to communicate. We're very good communicators as bedside nurses, but you got to work with different personalities. Change management comes into a huge part of this. Virtual nursing, I think, in general, is a new field of nursing. CJ alluded to that a little bit earlier, that, we have to take into account that this is a big difference. It's a big change for a well-established nursing team that is not familiar with how virtual nursing can support them. And so communication is so key in showing them that you're not Big Brother watching over their shoulder. We are actually a collaborative team member here to support you and support the patients, with the patients and you as a nurse as our best interest. Because without the nurses using us, then we are of no use. We need them, they need us, and I think that is what makes it a very beautiful, cohesive relationship that we have here.
Got it. Okay. So CJ, one thing you mentioned a little bit earlier, I thought it was really interesting, how from your experience, you have like all these, you're in the room, they keep on calling, it's almost like generate more work. It's almost like maybe build on top of Kelly, this communication. It's almost like sometimes what technology can amplify the disruption and then your productivity will decrease. I mean, is there, on the scheme of telenursing, there's certain area like it could either be damaging or be negative to in there? Like, is there certain thing, maybe the audience member should be really watch out for, like just like you could have a mess if you do that. Like,
I love the question, Milton. Something I've been talking with a lot of my colleagues, tech nurses across different orgs about is this proliferation of point solutions, right? One organization does one thing really, really, really well, but it doesn't integrate with anything else, right? So like, I forget what hospital I was at, but like the average nurse had something like 6 different devices on them for like different things. And associated with that device was like a different workflow or person who's only looking at that one thing, right? So like only, one person was looking at like call bell response, and someone else was looking at like, are you answering your phone? And, it's just, and so I think for anyone, and particularly in the context of, we're implementing a solution, but you have to understand it in context. And I think we need to spend, it's so important to spend a lot of time, not just with the person who's going to be using the solution, but thinking through how all of these different pieces and parts come together onto one, like you could say one platform, but whatever it is, like the way that people are going to experience this in the context of the million other things that they have going on. I think that's something that we can lose sight of, where I have like, this is an amazing algorithm that can do this amazing thing, like fall risk, right? So like I see a lot of solutions out there, like using computer vision to anticipate fall risk. Fantastic. I am so excited about the way that we can leverage computer vision and AI and ML to do amazing things. But like that fall risk, like one, we got the bed alarms, but also like it's one component of 6, 7, 8 patients that I have going on. And so being very conscientious about how we are assessing and quantifying how these solutions are having a real impact, not just on the patient, but also on the person doing the work. And I think it goes beyond just like saving time. I think it also is associated with like the joy that people feel in being able to deliver their work, right? So, yeah, so I could go on and on about that, but
So
that's, yeah.
yeah, so one thing I feel like maybe this is just share with the general audience in there. I feel like if the way the hospital making procurement decision is to say they go to 6 different vendors, like you mentioned there, then I think, but of course, these vendors doesn't work with each other. There's no way they can anticipate all the notification that will hit a bedside nurse in there. Right? So essentially, they would, by definition, be drawn. I would say is maybe for the audience members, right? If you could do procurement, make sure they should all flow, ideally Oracle Health. Have them able to control the nav, so
Oh,
that you
shameless
can.
plug, Ms. Milton. I
Yeah, a
appreciate
little
it.
bit. We're all friends here.
Yeah.
But I do think, even going back to my PhD day, right? Just communication, I agree. It's just like it's really easy to be good intention, but the end result you're just bombarded the people. That like I think if you don't have a way to turn up and down in there, you're just gonna increase workload and not decrease workload.
Yeah.
One of the maybe a follow question from the audience member, Kelly, what hardware and software platform are you currently using for your program? I think
Yes.
the audio member uses carries maybe they can replicate whatever magic you do in their hospital.
Yeah, absolutely. So for our continuous video feeds, we use an Ocularis. We also utilize Teledoc
Mhm.
as well. And the AI decision support tool I use, I absolutely love them, is Ediometry.
Mhm.
It is a great way to display a lot of information. You're talking anything that can be plugged in or routed into your EHR. It can display as a trend. So your vitals, your ventilator settings, um, medication drips,
Mhm.
vasoactives, and sedation, as well as labs, can all be displayed in a trend so you can see at a point in time how that medication has affected your vitals
Mhm.
or how something has changed in your ventilator and all of a sudden your vitals are off and you're really not quite sure why. Now, it is important to keep in mind though that this AI tool is just for inadequate oxygen delivery. It is not going to give you a diagnosis. It doesn't tell you this kid has sepsis. It just tells you that something is not right. And the algorithm is actually pretty great because it gives us
Mhm.
at least an
Is
hour
it
or
great?
two before,
Okay.
and the
Oh,
data is pretty close to real time. So we are able to have some time to look into these patients to
okay.
see what is actually going on with this kid and share that with the physician team.
Terrific. And then there's a follow question on that. Which EMR are you using?
Cerner.
Okay,
Shameless
of
plug.
course, the best.
Yes, we are
One of
using
the
Cerner. That's
Yeah, one of the audience member asks is, first is, does the telenurse interact with the patient directly or is purely to support bedside? And if the telenurse does interact with the patient, do you find the patient's attitude when they interact with the bedside versus tele, there's any differences? I guess the assumption is right now you're a little bit remote. Does it get more, less satisfaction, or maybe like, is there any difference? Yeah.
There is definitely a learning curve for both sides. For the patient side, for sure, it's a little bit of a learning curve. They're like, who are you and what are you doing and why are you on a screen?
Okay.
But after a little bit of conversation and some introduction, the patients are actually quite happy that we're there. Um, and for and because we are a hybrid, I can also walk right into them. So they're like, oh, you are a real person. So there's a component
Uh,
of that as well. So it's a little bit of conversation and introduction. But I think
mm,
with, because of Zoom and, FaceTime, video chatting, it's not that foreign of a concept.
mm, got it. So one thing I know you deal with, these are fairly critically ill, like patient there. For example, when I visit a lot of the hospital, right, when they do have those camera in the patient room, they on purpose, like, point them to just to give patient the privacy. Like,
Mhm.
Kelly, do you have any advice on maybe the spectrum of different type of these sort of maybe uh, telenursing service, at what level you should aim a camera at the patient, at what's the cutoff you actually should not deploy a camera?
Yeah, so our patients and families are able to turn the cameras away for whatever reason they choose. And we can contact the nurses later to assess whether it is an okay time. We personally ourselves have cameras on the patients at all times because they are so
Mm,
critical
yeah.
and anything can change very quickly. But I think in an acute care setting, that is can be
Mm,
slightly different. I know of other institutions who will turn the camera on when the family or nurse request.
mm,
And then from the other end, virtual nursing to patients, there's a notice, that comes on and says, hey, your virtual, nurse is going
mm,
to hop on. Is it okay? It's
mm,
asking that patient permission to come in. It's the same thing that you would do in person. Knock on the door. Is it
mm,
okay that I step in? Are you in a good position for that? And so it's applying normal etiquette in a virtual space, um, I
mm.
think is very helpful to maintain respect.
Okay. Okay, thank you so much for that. Um, so, Kelly, I know like so a lot of again, so like I know that from audience member, a lot of interest on telenursing is just because like the nursing shortages, because like the nursing burnouts in this. Again, from your program, have you seen an indicator that like your nurses are like compared to your other hospital, X% happier, they're staying their job, like just do you have those type of any like metrics or benefits that you have seen?
Yeah, so we are actually currently looking at those metrics. The first year that we were in here, it was a discovery year. It was a year
Okay.
of collaborating with our bedside nurses. They are our key stakeholders because they're the ones who's be using our
Mhm.
services and really honing in on what it is that they want from us, and also
Mm.
trialing it with them. We
Yeah.
trialed one time where I remember I was like right there texting, calling, everything that you don't want, everything that CJ doesn't want, like I'm already in the room. Why are you calling me? And and so like, okay, that didn't work out very well. So that first year we really learned to like kind of scale back,
Mm.
but also address, something that very important in a way that is respectful to the nurses and to the doctors. And so
Mm.
this goes back to like change management and really communication
Yeah.
with all the team members. The second year is when we're really much more well established and has like a nice plateau of, you know, communication and understanding of how we're supporting the team, and the nurses understanding of what we can do. And so that after that second year, we put out a survey for nurse satisfaction and they're very nice to us and gave us a very good score, but also a lot of great constructive criticism on how we can be better. And so this past year, we've taken all of that into account, and we are about to deploy another survey in 2 weeks, well, actually tomorrow, in February, and to really get another pulse check on how they're doing. From like an institution standpoint, we do have like nursing retention numbers that we look at. We have a very interesting mix of nurses at this moment, from a lot of wonderful agency nurses that are coming to support us and a growing staff. And so it is slightly difficult with a lot of different things in play to be able to contribute virtual nursing support to nursing retention at the moment, but that is definitely something that we're looking for. And the hospital also comes out with a nurse satisfaction survey, which we will also be, using that data in the next few years to really see if this level of education, real-time support, real-time education and feedback is what nurses want for growth. These nurses are type A personality girls and guys. They come into the ICU wanting to be the best. And so we have to support that, not just let them loose and take care of a patient and not really follow up. They want growth in some sort of way. And so we are looking of increasing our new nurse support program to be able to provide that type of growth, not in year 1, but also in year 2 and year 3, so that they can work at their highest level. So we are definitely taking all of that into account in the next few years.
Super. I think Kelly can't wait to, hopefully can publish on those results. I think the whole industry will benefit from that, and can't wait to learn from that. CJ, you have a very expansive view of, just like across many, numerous hospitals, like all these different things. Is there a certain area that is like underutilized or overlooked? There's that like area if you feel like people should really explore?
That is a great question, Milton. You asked so many good questions. So I don't know if this is what you want me to say, but this is what I'm going to say. So, Kelly alluded to earlier in this call, and I don't know that this is the most profound thought out there, but that like nursing charges is basically like part of hospital room and board, right? And so when we think about what the healthcare industry needs, what patients need from their care providers, it's really hard to quantify that objectively because of the way that the finances are constructed and because of the way that the current way that we do a lot of reporting and assessing is constructed. Right now, it's really hard to understand. I'm asking my nurse to do X, and it is having Y impact on my organization for Z cost. We don't understand that. And so when we are building out these solutions and talking about telenursing or AI and ML, et cetera, we still really struggle to understand fundamentally what about our work is driving what we want. Like we don't have that very granular assessment. And like I talk to CNOs all the time, and there's a huge emphasis on like rounding and understanding like what your folks are working on. And like that is fantastic. But like we also need to be able to leverage data so that anyone can understand and look at that information and say, not only, oh my goodness, that is intense, but also let's use data, let's use our analytics to identify where we should implement these things, where we should automate, where the best opportunity is for AI or like we just are not spending enough time at that like ground level. This is the way that people work perspective. And that's, again, shameless plug. I'm so sorry, world, but like, that's what makes me really excited to be at Oracle, right? Like I got so frustrated being in in a hospital and not able to change the tools that like I had to work with every day. And now with like the ability to like bring together Cerner and the tech of Oracle, like we've doing some really exciting things with like the ClearVia teams. That's our workload, basically like acuity team, to like really start to evaluate like that work environment piece, because everyone knows that work environment is a challenge. Everyone knows burnout is a challenge, but we're not granular enough in our understanding of
Yeah,
what can make it.
got it. So, CJ, if I can ask you a follow-up question there, like, by the way, so I love that chart you showed, all the nurse process you showed.
Yeah.
Like, when I first, first it does explain like the stuff that Callis work out. That's why it's just so incredibly difficult. Right? Like, this really.
Yeah.
At the same time, I also feel like the problem is so difficult in there. I'm almost like a little bit scared to say how to even like make progress. It's just so complicated. Do you like, if you were to recommend to your audience, is there a certain ROI, or how do you go about measure these? Like, again, when I think about that complex the process in there, it's just like it's like how to
Yeah.
even begin. Yeah, like,
Oh man. I mean, I think it depends on the challenges that your unique organization are experiencing. So I hear a lot about like a length of stay, time to discharge. Like
okay,
hone in on what are like the one or two things that you
yeah,
think are top challenges for your organization. One organization was looking at like adverse events, right? So taking an adverse event and then actually understanding at a click by click perspective, like all of the different things that went on in the digital workspace to drive that adverse event. But I think you do have to very tightly define your problem statement to start. And
yeah,
then once you've tightly defined that and you've identified and done the statistical work or the analytics, or, we're doing a couple really cool things that I hope to publish shortly about
okay,
using ML and biometric information. But like you have to have that problem statement defined, and
yeah,
then you can look for the correlative
yeah,
processes and start to optimize
makes
them.
sense. Well, that seems great. Yeah, if you don't, yeah, you gotta scope the
Yeah.
problem properly there.
Yeah.
Again, so we're coming up to the end of the hours in this. Again, so CJ, Kelly, thank you so much for sharing all the insight. Maybe I leave one final question for each of you in this. You guys are all expert in your field, have so much tremendous experience in this. What is something that, like, one thing that you believe, like something around telenursing, that the rest of the world has not caught up yet? They don't believe yet. Maybe CJ or Callie, do you want
Yeah, I'll take a stab at it. I'll take a
to say it?
stab. I don't know that the rest of the world doesn't believe it, but healthcare, like you said, Milton, is incredibly complex. None of us is going to solve the
Yeah.
challenges of healthcare by ourselves. It takes
Mm,
a it takes a robust network of partners that have diverse experience
yeah.
across the spectrum of healthcare to come together and accomplish these things. And that's why I love, like, even just this microcosm here, you at VSee and Kelly the nurse and Oracle Tech. Like, it takes not just the people who know how to do it, but the relationships associated, right? Like that we have spent
Yeah.
time together working
Yeah.
through and
Yeah.
talking through these really hard things,
Yeah.
and the trust that is built
Yeah.
between these different partners.
Yeah.
So I don't know that anyone would like disagree with that, but like
But,
healthcare is not a one-stop shop fix,
yeah.
but building that like network of folks who are committed to
Mhm.
the same vision of healthcare that you are and have the diversity of
Yeah.
tools to fix it, I think that's essential.
Got it. Thank you so much for sharing that, Kelly.
Completely agree. From a virtual nursing perspective, at this moment, I think there's about 35% of hospitals that have some telehealth program,
Yeah.
virtual nursing program. I think in the future that this is a standard of practice. This
Yeah.
is a new field of nursing that,
Got it. Yeah.
is being established. At the
Mm,
American Telemedicine Association, we are really looking at, and collaborating with a lot of different institutions to say, well, what is virtual nursing? How do we
mm,
standardize this? How are you all developing, your
mm,
own virtual nursing program? I think right now it's easy. You want a med surg unit? No problem. Everybody's
yeah.
doing a med surg
Yeah.
unit. We know, the qualifications for a nurse that needs to be on that
Yeah.
unit. We know the technology that's needed, the room setup, and how to function. But for virtual nursing, it's slightly different. And for different types of patients and for different, you know, groups of nurses, experience levels of nurses. And so, I think virtual nursing will end up being a standard. And with that, could that actually help improve and be sustainable for our nursing workforce? Can this decrease nursing workload? Can this real-time education, support, mentorship, collaboration, innovation be what bedside nurses need and want? And can shift from bedside nurse to virtual nurse? Because right now the path is bedside nurse to CRNA and NP out of the medical field. But I want all of their knowledge to stay within their very specialized fields. So can this be that other space for them?
Awesome, Kelly, thank you so much. Again, so thank you so much, CJ and Kelly, for speaking with us today and sharing your really amazing experience and insights on telenursing. Again, for the audience member, we hope you learn the insight. Again, their contact information is on the slides in there. Again, we'll be sending out the recording and the slides following the session. And we're looking forward to seeing all of you at our next Telehealth Secrets webinar on the next segment on telenursing on February 21st. Again, see you soon. Again, thank you.
Thank you, everyone. Thank you, Milton. This was fantastic.
Thank you. This is
Thanks,
awesome.
Kelly.
Thank you.